Good afternoon, everyone, and welcome to today's webinar, The Weight We Carry. We are so glad that you are here to join the Foundation for the Mid-South for our mental health, maternal health, and obesity conversation. This discussion brings together experts who work every day to improve health and wellness across Mississippi. Before we begin, I would like to thank our sponsors, the W.K. Kellogg Foundation and Mississippi Truth, Racial Healing, and Transformation. Thank you for helping to make conversations like this possible. My name is Dr. Jamishia Ballard, and I currently serve as the State WIC Director for the Mississippi State Department of Health. I am excited to moderate today's webinar. So let's begin the conversation with Dr. Damian Thomas. Dr. Thomas is the clinical director at Resilience Counseling and Recovery Center. Dr. Thomas will discuss the links between mental health and obesity in the state. Dr. Thomas.
Good afternoon, everyone. Thank you for having me on. I'm going to talk about those connections that were just noted. There are many, and I think once we draw these conclusions, we will be able to understand further about the connection and the interconnection, rather, more specifically to obesity and mental health. And so once we look at it, though, we're clearly talking about various systems working together. In this case, we're talking about serious mental illness. We're talking about the depression, and that we're seeing percentages as high as 55% in terms of the odds of developing it. And of course, we're also looking at the difficulties that individuals with serious mental illness experience in terms of maintaining a healthy lifestyle. And this is clearly a significant issue. And so just further, when we talk about those serious mental illnesses such as schizophrenia, the prevalence of obesity is around 25%. And of course, combined weight obesity at 60%. We're seeing that there are other related issues such as anxiety disorders, binge eating, body image concerns, and of course, the lower quality of life when we start looking at these associations. Now, when we start looking at biological and physiological pathways, we're talking about inflammation of various systems. In this case, we're talking about the immune system. And so being overweight does place individuals at risk in that regard. Our endocrine systems, specifically when we start talking about cortisol and how individuals manage stress and other factors that are related, such as appetite, and even the sensations of fullness that's not necessarily acknowledged within these systems if there are individuals that are overweight. And as a result, the persons they continue to overeat and not experiencing the benefits of having those sensations. So when we start thinking about dopaminergic systems, serotonergic systems, serotonin, we're clearly seeing that the reward systems are being addressed and affected. And as a result, these individuals may have a tendency to eat out of emotion, or emotionally eat, as we call it. And so there are clearly biological systems that are at play, and that it's important to acknowledge these. And so once we start looking at other factors such as psychological and behavioral pathways, now we're talking about things that we normally see in the community, such as stigma. Of course, we know that there's a stigma associated with being overweight, but in addition to that, we're talking about shaming, body shaming, internalized weight bias, which translates and can translate to low self-esteem, social withdrawal. Of course, in that we see depressive symptoms at play. And so, as I stated, emotional eating, comfort eating, those are all significant issues which exacerbates the weight gain that may be already there. Or when we stress eat, that is a very common issue. And of course, using that as a coping skill, it's not something that we would encourage. In this case, is a maladaptive coping skill. Um, when we start looking at our sleep or not being active, all of those contribute. And so we see a compounding of issues that continue to do that if we're seeing that either one or two of these issues are at play. And so in this case, we want to be mindful of all of these systems because they do work, although independently, they can have a direct association. Now, when we start talking about medications in mental health, this is something that we don't talk about enough, I think. When we start talking about psychotropic meds, some of the antipsychotics, mood stabilizers, weight gain can be a side effect. And so it's important to make sure that these individuals speak with their physician prior to taking these medicines because it can exacerbate other areas. But generally speaking, your doctor is going to let you know of the side effects, but it's important at the same time that the consumer be aware of it, just so that you can consider possibly taking an alternative rather than the one that may be prescribed. So when we look at some of the other evidence, again, we know that having um, uh, these problems with weight gain or being overweight has a correlation with depression and how depression can predict future weight gain. And so there's this constant effect that's playing at the same time. Mediators such as emotional eating, again, that is a significant one, and we see that one pretty often in a lot of our work because it's quite natural for us to want to feel better, and sometimes we go on whatever we see available. Sometimes and oftentimes that is food, and so that can be a significant issue. So some of the interventions that we consider, we talk about how to manage this. Of course, screening is the first step. Making sure you're talking with your physician just to consider some of the issues that may be related. Of course, within that, these physicians oftentimes screen for depression and anxiety, and that's how a lot of our clients get referred. But either way, it's important to consider the whole person, making sure that we look at it from a multidisciplinary perspective, because that will allow us to effectively treat and allows you, the individual, to be in a place where you can address all of the issues at the same time, which is best practice. So the stigma, again, is very significant, because we're all we have our own insecurities, but when it comes to being overweight or even obese, like these stigma are real because we live in a society in which we receive a lot of benefits from not being overweight or for being slim or in shape and what have you. And so we know that it plays a role, but it's important also to acknowledge this so that we can begin to address it not only from a physiological perspective, but we will also want to look at it from an emotional and psychological perspective as well. So when we think about interventions, so weight management, that is a service that we refer our colleagues and friends to, for that matter, and clients. Weight management is an important part of our health. We don't want to have to accept that we can just be obese or overweight. Like there are other um, resources and there are other interventions that can help manage all of that at the same time. So some of the interventions that we address with our clients are, of course, lifestyle in general, making sure that the person has a healthy diet, engaging in physical activity. We offer cognitive behavioral therapy interventions, motivational interviewing, which allows us to be able to understand where these individuals are because everybody is not at the same place and situation. So once we meet them where they are, it allows us to offer interventions based on their emotional status at that time. We offer mindfulness based interventions and approaches. Of course, as I mentioned earlier, we refer for medication if that's needed for psychotropic medications. And then, of course, more than anything, we believe in an integrated model in which we know that our assessments are biopsychosocial. So we look at everything to make sure that it's not just a mental or an emotional perspective that's being addressed. We look at all of those areas, and that way the person can live a more healthier lifestyle. And of course, these are my references. If you have any questions, comments, feel free to reach back out to us. And thank you for your time.
Thank you so much, Dr. Thomas, for that insightful information and the points about mental health and evidence-based interventions. So let's bring up our next panelist, Mrs. Whitney Hunter Batiste. Mrs. Batiste is founder of Pickles and Popsicles, and she shares insight on how we support mothers, not only while they are prenatal, but postnatal as well. Mrs. Batiste.
Good afternoon, everyone. Thank you so much, Dr. Ballard. Again, my name is Whitney Batiste. I am the founding executive director of Pickles and Popsicles, located in Jackson, Mississippi. We are shifting our focus to postpartum support. So I'm going to be talking a little bit more about postpartum maternal health. But when we're talking about maternal health in general, we stop right after birth. And we're only thinking about moms if they're having a mental health crisis like postpartum depression or baby blues or even psychosis. But we don't tend to think about them beyond delivery if they're not having a physical issues with recovery. So in Mississippi and nationally, but Mississippi still has one of the highest rates for maternal mortality, with Black women, Black mothers being 4 times more likely to perish for those other than their white counterparts. And it's not because Black women, we don't take care of them, they don't take care of themselves. It is simply we just don't pay attention. But a huge part of that is the insurance gaps of that, right? And where we're now experiencing Mississippi expansion, Medicaid expansion, that will go up to 12 weeks. But for the most part, we stopped at 6 weeks. And we continue to collect data on morbidity and mortality through the first year postpartum. But if you do not have the coverage for a headache or a stomach ache or chest pains, if you cannot go to the doctor to see anybody about those things, then that is where you kind of fall through the gaps. Postpartum mental health, like Dr. Thomas spoke about earlier, 1 in 8 women experience postpartum depressive symptoms, but more than 56% of them do not receive care, either for lack of coverage, accessibility, and other determinants of health, social determinants of health will hinder that. And so figuring out where we can get it right, where we can do it better. And so what does postpartum neglect kind of look like? It looks like missed checkups. Okay, it looks like not being able to have a village to support you. You feel alone, you feel isolated. And there are just a lot that we do not do during that postpartum period that could make a massive difference. So the lack of inconsistent care or compassionate or coordinated care, when we're thinking about what we can do to improve overall maternal health care, we don't think about that for postpartum. And so not having postpartum care fully integrated into maternal health care, that is a good place for us to start. And so what the full recovery of a mother's recovery, ecosystem of a mother's recovery could be: chronic disease management, practical resources and community support, social support, mental and emotional support, and still the physical pieces, right? But we're not stopping at that 6-week mark, because I may be fine at 6 weeks and then I have to go back to work at 3 months and now I'm not okay. Now I need more help. Now I may need medication, but because I don't, that is not something that is generally talked about or considered, then I don't know to ask about it. And so we create these models where we constantly include postpartum moms as well as pregnant moms. And then we have continued care from pregnancy through beyond delivery. The timeline of where care kind of drops off in that 6 week period. So in that gap where birth, once they have the baby, up into that year postpartum, in that little section, we can include so much that could be holistic health for mom, from mental health to social support, also to community support. And so we are all each other's villages, not just your doctor that you're going to, not just the your WIC appointment that you're going to. If we collectively decide that a mom needs care and she needs various forms of care. And so most people think, well, if I'm helping come in and take care of the baby, then mama is fine too. Mama needs more support. There is times that she needs to be a person outside of being a mother. And so here at Pickles and Popsicles, we are looking to expand what your thought is about postpartum support. What does that look like? How can I help a new mom, or even a more seasoned mom who just had a new baby? And so if we truly care about the importance of postpartum moms, then we have to care for them beyond delivery. Thank you very much.
Thank you so much, Mrs. Batiste, for sharing information about the support needed for mothers in the postpartum period. Our third speaker is Ms. Astria Goolsby. Ms. Goolsby is the Director of Marketing and Public Relations for the Family Health Center. Mrs. Goolsby will share information about obesity and the efforts being made to address it. Ms. Goolsby.
Thank you so much for having me. So today I'm going to explore something that I'm very passionate about, and that's obesity in Mississippi. And we're going to talk about how it affects maternal health. And we're going to look at current data, risk pathways, and key solutions. So Mississippi leads the nation in obesity rates, which is something that we already know. It's 2025. We've heard the data, we've seen the data, we see the evidence in our own communities. The alarming part is that this is especially concerning among women of reproductive age, where rates exceed 42%. Mississippi also ranks among the worst in maternal outcomes, with over 80% of maternal deaths considered preventable, meaning that there are opportunities in which we can step in, and obesity cannot be one of those causes for maternal death. Obesity risks are for complications like obesity causes risk for complications like gestational diabetes, preeclampsia, and C-sections. All of these also impact the baby as well. So these risks don't just stop at delivery. Children born to obese mothers are more likely to develop obesity and metabolic conditions later on in life. And there are several systematic barriers like rural access gaps, food insecurity, environments not conducive to physical activity that make it very difficult for women to get the care that they need. To reduce maternal obesity risk, we must improve access, invest in early interventions, and support healthy lifestyles through community programs. So we do have the tools that it takes to change the story. We all do as a community. So if we come together and prioritize maternal health equity and take coordinated actions to protect our future generations, then we can reduce these numbers. Thank you for your time. I'm happy to take any questions.
Thank you so much for sharing your expertise, Ms. Goolsby. We appreciate it. So we will now transition into a brief panel discussion to explore a few big picture questions and reflect on the key takeaways from today's presentation. Okay, moving into our first question. What are some promising and innovative practices you have seen in your field that are helping to improve practice? And I'll repeat the question. What are some promising and innovative practices you have seen in your fields that are helping to improve practice?
I'll start. Um, Being able to identify comorbidity, I think that has been a huge part of us being able to treat. And so when we're addressing a situation, particularly an illness like depression or even anxiety, we're seeing how it can affect other areas of their life, or we're seeing how the attempts to cope has either exacerbated the depression or has exacerbated their general physiological health. And so we will do assessments on eating habits, such as binge eating and other eating disorders. And once we pinpoint that, for us, it makes it easier because now we can offer co occurring diagnoses. And then at the same time, we can offer an integrated treatment. And that is huge because now we're addressing both of them at the same time, which is best practice. But at the same time, that person, they get help in more than just one area.
Thank you for sharing, Dr. Thomas.
Thank you.
I would like to speak to that next. I think that for especially with Family Health Center and a lot of other community organizations that address health that I have been blessed to be able to work with, resources such as mobile health clinics, getting out and taking resources and services to the communities where they serve. I think we should lean more into just putting more resources into those types of services. Also, services such as that are provided by social services department. I think that the social service department with community health workers is one of our most underused and under resources, but most valuable tools that we have. Community health workers and social service workers within the healthcare community, they have the training and the resources to actually go out into the community and find out what the barriers are. um, like you should do with when you're addressing any type of challenge. There should always be an assessment. And I think that social service workers and community health workers are the front line of that assessment by actually creating that relationship. Because when you do start to speak about the mental capacity of things, there is a mental part that has to happen before you can make any type of change. Behavioral change model shows us that. And so if you can find that person, which I think social service departments and community health workers, they serve that purpose to go out and make that relationship with those people and find out what the real barriers and challenges are within that particular community. And when we say community, we're not talking about Jones County. I'm talking zip codes. I'm talking neighborhoods. I'm talking micro going down to that street, because someone not having access or not being able to get to a bus that is just 1 mile away because they do have chronic conditions such as knee pain and they don't have anyone to take them to the doctor. And bringing those services to them and knowing where we can target our services would be best use of our current resources. And I think it would be beneficial to put more resources behind what we already have, versus trying to recreate the wheel.
And to piggyback on what both of you all have said, absolutely. So sometimes we rely solely on the medical professionals to assist us when we as a community can do more. And it's not that we don't have access to all of these things. It's like what Astria said, that they're in these hubs or they're in a county, but we need to make it more specific. And so some community-based models that we could start building our support, especially for postpartum moms. So coming to the house to visit, right? To help to put together baby gear, to assist with lactation or anything. And so we have some of those in separate instances, like Healthy Mom, Healthy Baby, and Healthy Start. They have programs, but we need to make that much more accessible. Peer support is a huge contributor to how someone can feel more supported. If I have a circle of people who are also going down the same journey that I am, I have somebody to talk to. So when I start feeling a little crazy, like, oh my gosh, it's just me, my kid is, it's terrible. But then if I talk to another mom and they're like, oh no, them terrible twos, let me tell you what to do. And so realizing that we are better together, we can get more accomplished together. And then also we have to figure out ways to fix our fragmented healthcare systems, right? Because I should not be filling out postpartum depression screenings at my pediatrician's office and not my obstetrician's office. And so creating a pipeline or a referral system from one healthcare provider to another. So if that is not your area of expertise, you now have a referral system in place. And so those little steps could change the game.
Thank you all so much for sharing. Those were some very promising and innovative strategies. We appreciate it. We're going to move into our final question, which aims to help those around us take action in our total well-being. The question: how can communities unite to help improve outcomes in your field? And I will repeat, how can communities unite to help improve outcomes in your field? And we're going to start with you, Ms. Goolsby, since you're in that community space with Family Health Center.
Oh, so I would say the first thing that you can do in your community is, one, talk about it. Talk about it and stop joking about it. When you go to family dinners and we talk about, I'm on a diet, or I'm trying to reduce my glucose numbers, and then you grab a soda, I think that it's time to start taking these things seriously. I think that in the community, we've got to some type of way reverse that mindset of someone's going to come and help us, that we need to start taking ownership of our bodies and our choices that we're making. And then also, I think that we need to start helping others when you see someone else in need. When you're in places and organizations, community organizations such as churches, such as the community, the senior center daycare, talk to someone and ask if they need a ride. If you know where resources are, share those in your churches. If you know where resources are, share those and send notes out in schools in the kids' backpacks and say, hey, this is a list of every school semester, send a list of local resources in the community, because we don't know what's going on in an individual's house. And I think that also voting and not just going out to vote, because I know some people who will go out and they will vote, but do you really know what their platforms are, and are they speaking on behalf of you and what's going on in your community, in your street, your neighborhood? So I think those are the things that we can do to come together as a community to improve what I do in my profession.
Thank you.
I'm going to go after her because you're in the community, and a lot of what I'm about to say is community oriented. I say all the time that we know that it takes a village to raise a child, but it takes a village to be a mom. And basically it takes a village for us to do anything, because we are not supposed to be living in silos. We are supposed to be working, living, communing together. And if the more I know about my neighbor, more often they can call me if something happens. My neighbor called me yesterday, like, hey, can you, take my baby something to eat? It doesn't matter, because I am in community with you. And we have kind of lost that a little bit. But I think normalizing, especially for moms, normalizing those talks about your mental health, right? Because so much happens in isolation. When we are alone, or we feel like we're alone, those problems, those issues, they get bigger. Everything seems larger in isolation. But the more you talk about it and destigmatize your feelings about it, your cultural feelings about something, or going to see somebody, going to see a therapist, or just talking to a friend. But we have to destigmatize that just by opening our mouths and talking. And so if once you start to implement, hey, you know what, I'm here for you, let me know, call me if you need something, I was in the neighborhood, I get the grocery store, do you need me to pick you up some eggs or anything? We have to be more communal, and we have to start talking about those things that have become very serious and detrimental to our communities. And like Miss Groomsby said, that we kind of joke about it a lot, like, oh, I was feeling so crazy with my last baby. No, that's called postpartum depression. Or I was feeling really crazy, or really down or really fatigued during my pregnancy. Hey, that's perinatal depression. And there is medication, there is support, and there are people. But one of the main things I think is hard for us too is accessibility. So on one hand, we're telling moms, here's a list of all the things that you need to feel better, to feel more supported. And then also there's a price list on the side. And so when we're talking about mental health, even if I have insurance, there's a $90 copay. And if I have to choose between groceries and talking to someone, what am I choosing? And so we have to weave accessibility into the conversation as well.
Yes.
Thank you.
Well, I totally agree with all of those points. It definitely requires a community effort. It requires everybody to be involved. And, from my perspective, one of the things we've encouraged and we try to advocate for is making sure that the community is trauma informed. And that literally allows us to be able to empathize with where our clients are, to understand socioeconomic status, to understand that there are food deserts, to understand that everyone does not start on the same footing. And in that, it allows us to be able to treat and to be able to have a destigmatizing approach to this, because we all have mental health, yet everyone is in a different position. And so, but when we consider a multicultural perspective, when we consider certain populations of people who may not have the privilege of having access to resources, as I just heard, and that's a huge component. And so when we do that, it allows us to really offer adequate care. It allows us to be able to feel free to approach someone for support, for help. I heard that we should talk about it in all these different arenas, whether it's the church, even in our policies that are coming forth. And we're hearing a lot of things that are not evidence based. And I think oftentimes, that we try to make certain things political, and they're really not when you look at the data. And so, in other words, as clinicians, we advocate. Like when we go to the Capitol steps every year, we talk about the issues that we're seeing, and we're hoping and praying that the people that we're talking to, these elected officials, understand it, because quite frankly, they're not necessarily a doctor or a mental health professional or work in the medical field in general. So they're relying on us to be able to give them the information so that they can make the correct votes or the right move in these committees. And so we have to advocate in the clinic and also outside of the clinic.
I would like to kind of extend on that a little bit. I think that something that you said is very important, and it doesn't get spoken about a lot, is research. You would be surprised at how much research is not done within our community, or at least the data isn't shared or it's not easily accessible. I think the research world, looking at how they put out certain information and research data when we do have these topics that are coming up, I think that making it a lot easier to find reputable sites and data on those sites, making that what we see every day. Because when it comes to marketing, it is about what's in your face and in your community. You can control what you see. It's there. If you see a building you don't like and all of a sudden it's gone next week, that's because it was an eyesore to someone, and someone said something to someone, and someone made a move to someone. or if there's paper on the ground, someone says something, there's a pothole, someone says something. So if we start talking about what we want to see in our communities that will help change our mindset, I think that putting the information out there, but also conducting research, working with those organizations that do research, I think that's very important so that we can be well informed on making a decision.
And also what's happened with the research, they will come, especially to places like Mississippi, and they will collect all that data, they will collect all our stories, and then they implement it somewhere else. And so that has been a running issue. And so when we are an organization who conducts and participates in research, and I make it clear with all of my partners across the country that whatever the implementations are and whoever we are studying, it has to be Mississippi moms, and it has to come back to help Mississippi moms because they are using that data. They are using these stories. They're using Mississippi as the groundwork for whatever it is that they want to do. And then when they get what they need from us, they take it and implement it somewhere else. And so even researchers or those who are going to participate in research need to make sure that it is coming back home.
And then to follow up on that, Whitney, I'm going to say this. We have to make sure we participate. I think that's the point of what I want to make clear today as a community representative of someone who has been in this field and in the trenches to help fight and combat obesity. I need people to go and participate. I need you to go to the gym. I need you to go to your trainer. I need you to go to your doctor. I need you to participate in the diabetes prevention program, the diabetes self-management program. When you see a program, you know of a program and you know that you need it, I need us to take priority of our own health and participate, because that's another reason why these programs are not here. It's because when they were here, no one came to my class. When I did put it on Facebook, it was, oh, my grandmother needs that, but your grandmother never showed up because no one was willing to help her get there. Participate. And if we don't start participating and taking ownership of the part that we can do with just myself, Astria, is walk through the doors or to say, hey, I need some help, then we can't expect all of these things that us as professionals are fighting for to actually make a difference. So I'm putting that responsibility on the community and all of the listeners that are here, including this panel, because we're not exempt from any of these conditions just because we're in this profession.
I completely agree. Thank you all so much for sharing. I know that we are prepared to leave here today, ready to have open, honest conversations about accountability, destigmatizing issues at a personal and community level, and advocate for trauma-informed care and interventions. And we're ready to show up. So we are moving to the end of our webinar. Thank you for being here and engaging with us today. Also, thank you to our panelists, Dr. Damian Thomas, Whitney Hunter Batiste, and Astria Goolsby, for sharing your knowledge and experience with us today. Also, a big thank you to our sponsors, the W.K. Kellogg Foundation and Mississippi TRHT, for your generous support. Thank you again for joining us. Stay tuned for details about our final webinar of this season. Thank you.